Hello, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you today about concussions, closed head injuries. So some of you may know that I'm a child and adult neurologist, but I'm also the owner and founder of Urgent Care 24/7, a national urgent care company, actually the only 24/7 national urgent care company in America. And I want to talk to you today about concussion. I'm actually filming this today from beautiful Athens, Georgia, home of the University of Georgia and the University of Georgia Bulldogs. We have a clinic here in Athens called Bulldog Urgent Care that is not affiliated with the University of Georgia, but is right next to the campus. So we take care of a lot of students, and we take care of a lot of student athletes from time to time. Again, we are not affiliated with the University of Georgia, but we are in the same community. So we see a lot of athletes nationally at all of our clinics all over the country who have suffered a concussion. And concussion is a state after a head injury which can typically be self-diagnosed because patients will feel fogginess, nausea, headaches, either insomnia or increased lethargy, difficulty concentrating, dizziness. And some patients will just describe, I quote unquote, I just don't feel right. But with this plethora of symptoms, concussion is incredibly common in the U.S., especially as it relates to young people and contact sports. But contact sports, I might tell you, includes cheerleading, soccer, baseball, softball, basketball, and football, of course, rugby, and many other sports events. And I'll tell you, some of the worst concussions I've seen have actually come from cheerleaders, especially from doing high-risk stunts as part of their cheering. So I've often told people one of the most dangerous sports in high school and college is cheerleading, because they do some amazing things, but also some very very dangerous things. And of course, they're not wearing head protection, so when things go wrong, they can typically go very wrong. But we see a lot of patients with concussion, closed head injury, whichever you want to call it, and there's a complex a system to grade concussions that help us manage how those concussions are handled medically. But I don't want to dive into those details today. I just want to talk about closed head injury or concussion and emphasize the importance of even the most minor concussion, even the most minor of symptoms should be taken very, very seriously, and you should seek medical attention immediately should that happen. And the reason for this is because what we've come to learn about concussion is the more concussions you have, the more susceptible you are to additional injury and more severe injury with subsequent injuries or events, concussive events. Of course, these can happen from a motor vehicle accident, bicycle accident, motorcycle accident, any kind of impact or deceleration injury, such as in a motor vehicle accident where the patient or the passenger will lunge forward and causing the brain to move forward in the skull, and could cause what we call a contra-coup injury, where the brain actually strikes because the brain is floating in cerebrospinal fluid inside the skull, where the brain will actually strike on the front of the skull and then on the back of the skull. So we can see a contra-coup injury on the front and back of the brain, as well as injury within the brain substance from shear forces that can actually damage the neurons or the actual substrate of the brain itself through the energy passing through the skull and through the brain from acceleration, deceleration that can shear off or damage neurons. So again, just super important that if you've experienced a head injury or a deceleration injury and you're feeling any kind of symptoms that I outlined before, And even if you're not, important to go see your healthcare professional after that closed head injury, concussion, and get an objective assessment to see if there is any concern moving forward, establish a baseline, and also to get an objective opinion about what's the proper restriction of activity and or treatment of symptoms, whether it's with nonsteroidals, medications with sleep that will help with sleep, safe medications that will help with sleep, or anti-nausea medications that can help with symptoms until you or the patient recovers from their concussion. So I hope that you found this video useful. I appreciate you tuning in today, and I didn't want to get in the weeds on the closed head injury concussion classification system because I don't think it's very useful for the patient or their loved one or friend. That's more from a clinical perspective, and if you've got a severe concussion or you have a concussion, your healthcare professional can go over your degree of concussion and discuss those specifics with you. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.